Well, welcome everyone. Thank you very much for joining us. My name is Jim Mazzo, and I'm pleased to be kind of chairing this with some illustrious panelists. Before I turn it over and have each of our panelists describe and give us their tremendous background, I would like to thank on behalf of OWL for you joining us today. Very busy times in all of your lives. I'd also like to thank PANELISTS, who's sponsoring tonight's webcast, as well as the OWL partners, Alcon, Allergan, Bausch & Lomb, J&J Vision, Novartis, STAAR Surgical, and Zeiss. Without you companies, we can't continue to do what we want to do here. You know, for those aren't familiar with OWL, and I question, how can you not be familiar with OWL? But if you don't know what OWL stands for, it stands for the Ophthalmic World Leaders. Its mission is to provide both the professional and personal development and create unbelievable opportunities for this collaboration, which is interesting, going to be our topic for today. But obviously their ultimate vision is to promote and develop diverse leadership to advance our great industry, our innovation and patient care. Beth Marsh will be at your door to become a member, so please consider this great organization. It's of course a 501(c)(3) nonprofit, and it really is truly the only organization that works across all of our sectors, uniting all of our stakeholders. So it's obviously fitting that as you look at this great panel, we have a really diverse panel. And now what I'd love to do is I'd like each of them to do a quick intro before we dive into these questions. So I'll start with Jeannette. Jeannette, if you do a quick intro for us.
Yes, thanks, Jim, and thank you to the OWL leadership for the invite. So Jeannette Bankus, I'm the president of surgical and general manager at Alcon. Technical background with a long history in med devices. So happy to join you this evening.
Thank you, Jeannette. Hayley?
Hi, my name is Hayley Boling, and I'm the CEO of Boling Vision Center and Insight Surgery Center in Northern Indiana. We are pretty much smack dab in Notre Dame country. So for those of you that don't know where Elkhart is, that's where I am. We are a 10 provider practice. We have 4 locations on the clinic side and then 1 ambulatory surgery center as well. And it's a dynamic group, over 100 employees total. And it's been a really interesting time with this COVID-19. So I'm super excited to be here to continue the conversation. So thank you for having me.
Thanks, Hayley. And Amanda, all the way at midnight in Italy. Welcome, Amanda.
Thanks, Jim. I'm Amanda Cardwell Carones. I'm representing CARONESVision here in the hot spot of Milan. I've been working in the industry for the past 20 years, but I've been helping my husband for the past 2 years to open up a new multi-specialty clinic and day hospital here in Milano. Incidentally, the new office opened exactly 3 weeks prior to the first diagnosis of COVID-19 here in Italy. And at the same time, I've been transitioning back into industry, working for as the head of the Global Education Department for BVI. So needless to say, the last 3 months have been absolutely crazy for us.
Well, thank you, Amanda, for joining us this late. And now, Caren, how are you today, Caren?
I'm terrific. Thanks, Jim. Thanks for having me. I'm really excited to be part of another really terrific OWL event. My name is Caren Mason. I'm president and CEO of STAAR Surgical. I feel very honored to be in this role. I've been with the company for about 5 years. And our focus really is on refractive correction, visual freedom, visual safety. And we're really pleased with our progress as of late and very excited about our opportunities going forward. So it's really great to be with you all. Thank you.
Thanks, Caren. And the good Dr. John Vukich from Wisconsin. How are you, John?
Well, thank you, Jim. So hi, I'm John Vukich. I'm in my 30th year of clinical practice. So my career has been built around clinical education, physician education, and research. And I've been lucky enough to work with some of the greatest minds in our business. And with that, it's my honor to introduce Jim Mazzo, who's one of the giants who have influenced how we provide eye care throughout the world. I'll say a few words because Jim was too modest to share with you when he first came on. His global reputation for building and running world-class organizations is based on 22 years leading Allergan's North American and European eye care organizations, 7 years as chairman and president and CEO of an AMO, 4 years as Executive Vice President of Abbott's Global Ophthalmology business, and 3 years as Executive Chair and CEO of AcuFocus, and nearly 4 years as the Global President of Ophthalmic Devices for Carl Zeiss MedTech. We are in good hands with our moderator today, and I'm looking forward to learning a lot from all of our panelists.
Thanks, John, and thanks to my wife for sending you that great introduction. I'll have to thank her later. You know, there's a lot going on, obviously. How many of these seminars we've been on with regards to COVID and how it's impacted a lot of lives. And you know, candidly, as I look at these beautiful faces, we are fortunate, obviously a lot less fortunate. But we can learn a lot from each other. This is my 40th year, and I've learned every day from each other. And what's great about this industry, and look at the reflection, it is peculiar because industry as well as great practitioners like Dr. John Vukich have always worked together to progress. And I truly believe that when we get out of this, or as we get out of this, it's going to be because of that collaborative effort. So that's really the theme today, to talk about how we're all going to work together to get out of this. I've had the fortunate experience to know Caren. She's awesome at STAAR. Amanda, what you've done. Hayley, I've watched you over these past couple seminars, and Jeannette, thrilled to have you part of that Alcon team. So it's great to have this group of leaders. And so let me jump to the first question. I'm gonna go John, Hayley, and Amanda to build on this. So obviously your practice is challenged, as you were talking about, Amanda. I'd love to know how you're handling during these difficult financial times, and how you plan to really go out and reboot the practice, as we've heard. So John, why don't you start now? How are you handling all this, and how do you plan to reboot as we go forward?
Well, we're all facing similar challenges. There's some regional variation, but you know, we saw immediately that this was going to be something that wouldn't go away. And we made what I think was probably one of the most difficult decisions in my career, and that was to furlough our employees. And we had an employee meeting, and we said, well, we could alternate weeks, we could do any one of a number of things. But it was really important, one, that with the furlough, they kept their medical insurance, which we thought was really critical. And secondly, we felt it gave us the best chance to preserve the jobs coming forward. We immediately set up a team to help file the paperwork for all of the things that would be, you know, the ability for them to still have an income through unemployment, and we've kept in touch with our employees. But we're starting to bring people back, and everyone has understood. But I think that was the first step. The next step really is taking a look and saying, all right, realistically, how long do we have to plan for? And I'm afraid the initial optimism of just a few months has really given way to what we think is the reality, that this is going to be a long haul. It is probably until next spring. We believe that there may be some return to the volumes we had previously. So those are the things we're thinking about, the things that we have done, the actions we're taking to get started.
Hayley?
So, you know, as I mentioned on the last couple webinars that I've been on, is that as a practice, we have kind of this silver lining seeker kind of a personality. And so we had a meeting in early March when this really started kind of first coming to the forefront of everybody's minds. And we decided that this type of situation can either be tragic for a practice or can be transformational for a practice. And because of just who we are, we decided that we are going to make it transformational. And so part of what we did was we created a kind of like, you know, the four legs of a stool, and we wanted to make sure that we were sturdy all the way around. So those four legs that we really focused on was a culture first focus. And so doing everything that we possibly could to maintain the integrity of our team, making sure that people still felt acknowledged and heard and loved and a part of something bigger than themselves. And so making sure we did that through, you know, weekly hot meals, and making sure we provided Section 139 funds because we were federally declared disaster zone. We were doing, you know, unemployment insurance support and helping people to get through that entire mess. We had a compassion fund that we actually created to make sure that if anybody was short on funds, we were able to actually help them. So much like John was saying, we did furlough about 75% of our team. We that within 48 hours of creating our four pillars that we decided to have. And so we did that because we thought that it was important for these people to have a head start on the unemployment insurance claims. We wanted to make sure that they started getting paid sooner rather than later. And so we made that decision on March 19th, and we've been dark since March 20th. For the most part, about 5% of our business has been operating just for emergencies and urgent cases. We have been triaging for all of the hospitals in the area, which has kept us busy. You know, ironically, when people are at home more, there's more eye emergencies. We've had anything from people that have been injured while exercising to, you know, household chores and different things like that. So that's always interesting. But we wanted to make sure we got a head start on that. And so we helped people through that. We created Facebook groups and sense of community. We had virtual happy half hours. You know, we had a variety of different things that kept people engaged and feeling a part of something big. So that was the culture first focus. We also had a focus of operational efficiencies and technology adoption. And so we wanted to make sure that if we had the opportunity to rewrite the script, if we had the opportunity to revolutionize the way that we deliver eye care in our practice, like what would it look like if we could rewrite it? And so we took the opportunity to kind of like flip everything upside down and say everything's on the table and everything's off the table. Nothing has to stay as long as we maintain compliance. So we kind of, you know, we took that approach and we started looking at, you know, a variety of different technologies, maximizing our EHR and EPM systems, looking at those types of opportunities to kind of revolutionize that and really modernize our service delivery model. Our third pillar is the financial discipline. So historically, because of my business background, I didn't share with you, I've been in the industry 10 years now. I'm an MBA, I'm a COE, I'm on the board of ASOA and OWL, and I also consult. And so I have a kind of a broad and diverse background in business, especially in ophthalmic business. And so I understand a lot of the financial elements going into a practice. However, a lot of my management team doesn't necessarily, they're not always a part of all of those conversations. And so I started having mandatory meetings where my direct reports were all part of those financial meetings because I wanted to up the game of that financial acumen. So they were a part of the payables and receivables discussion. They were a part of all of that so they could see the impact that every single expenditure that we're having actually has on the bottom line. So we were really doing a lot of hard work to make sure that we were, you know, brainstorming ideas for not only cost containment, but also revenue generation. And, you know, I'm happy to report that we actually have had some interesting revenue opportunities throughout throughout this entire pandemic that they're going to stick with us, and that's kind of cool.
Right.
And then finally, the fourth pillar and the last thing I'm going to talk about is continual improvement. So we took this approach that nothing is a bad idea. Nothing is too big, nothing is too small. We're not going to worry about failure. We are going to learn from the mistake and fail forward. And so the continual improvement was that last of the four, because we wanted to make sure that we weren't afraid to think and to dream and to revolutionize and to say, hey, this is our opportunity to change the way that we do eye care. Let's make it amazing. And so that's kind of the way that we've been doing that. Of course, there's the traditional PPP loans and, you know, the HHS stimulus and all that kind of stuff. But at the end of the day, we really did a laser focus on who we wanted to be long term. And thankfully, that's been really successful for us. So we did start our practice back up at about 50% capacity on May 1st. This week, we'll be at about 75% capacity. And this is with a new model. So not everybody's coming through our office. So we have reduced foot traffic. We've actually increased engagement through additional touch points with our guests and our patients. And so my ultimate hope, which, you know, fingers crossed, is that we will be at about 100% of our original capacity by June 1st. So again, a silver lining seeker right here.
Oh, well, good for you. Congrats.
Thank you.
So Amanda, how's it from your end? You talked about you came on to open up a whole new center right before COVID. Talk to us about that.
Exactly. So the office opened up in the last week or so of January. February 18th is the day that the first patient was diagnosed here in northern Italy, and that was just before we left to go to winter ESCRS. So the city that we left and the city that we returned to were completely different. We got off the plane, returning to Milan, they had people checking temperatures as soon as we stepped off. We were under lockdown as soon as we arrived. So after the initial, well, because we're a medical practice, we were in private, so we fell outside of the regulations for the public hospital system. We were never forced to close, so we could still go in and we could still see emergencies or urgent visits, which were, at some days we would only have maybe 2 to 3 patients come in. After the initial, 1 to 2 weeks of shock and some near panic by the staff members, because there were just people were dropping like flies here in Milan. We decided to furlough a number of the employees. Now, fortunately, being here in Italy, there's government assistance available, and we were able to top up what the government didn't provide. So all of the employees who were put on furlough, they were still made whole. We stayed in touch with all of the employees during the period of time where some were on furlough at least once a week, with video chats, aperitivos, this kind of thing, to stay connected with them. Most of our staff members have been with us for a number of years, except for new positions that we've hired for. The positions, the people who have been with us for long term, some of them have been there for 15 to 20 years. So the level of loyalty that they have towards the practice is tremendous. After the initial 1 to 2 weeks, I told Francesco, I said, I'm not sure if I'm delirious now that I've been stuck in the house for 2 weeks straight with 4- and 5-year-old kids, or if there may actually be a light at the end of the tunnel for us if we start looking, similar to what Hayley was saying, if we start looking for the opportunities that are there. I'm 42 going on 43 and have never worn glasses before. Now that I'm stuck in front of my computer day in and day out, I'm finding myself reaching for a pair of reading glasses more often than I would like. And I said, I bet there are other people out there in a similar situation. And if we can start working towards reaching those patients, letting them know that what they're experiencing is normal, but it's a result of this new work environment that they're forced to be in, working from home, that there's something that we can do to fix it, once it's safe to move about again. So we started focusing our efforts a lot on social media and on various different touch points with the patients through webinars, through web-based aperitivo meetings with them, and really providing as much education as we could. We were fortunate that the new office, now that we've opened back up, so April 20th was the first day that we opened back up for regular surgical schedule. And most of those patients were pent up demand. They're patients who were postponed or originally scheduled prior to the lockdown. And believe it or not, they all showed up for surgery. They were waiting on pins and needles to have the procedures done. And we were fortunate that we had already, with the new office opening, despite the fact from a financial situation, it was quite scary and still is. We were fortunate that the office had been built in a way to minimize the number of patients in one place at a time. So we built the practice with the concept of delivering like a world-class patient experience where the patient felt that they were the VIP of the office. So we haven't had to make any changes from a structural standpoint, from an appointment scheduling standpoint, because it was already designed that way. The only thing that we've had to implement is PPE for staff as well as for patients. So all of our patients are provided full PPE when they come in, even for a regular visit or for surgical visits. We have infrared thermometers that are mounted at the entrance of the building, so the concierge can immediately identify if someone has a fever. We are screening and triaging patients for symptoms when they schedule the appointments as well as upon arrival. And really what we're seeing is whereas we were expecting it to take a while for things to ramp back up, we're really not seeing, from a surgical perspective, much time at all necessary for the numbers to bounce back.
Great. You all have different, even though you're different parts of the United States and obviously Italy, all different perspectives. I'm going to come back to the three of you on what have you learned too, which is going to help you better, because sometimes in a crisis, there's also opportunity created. So I'll come back to you. But now going to Caren and Jeannette, you lead two of the largest organizations, not just in ophthalmology, but in across our space in device and pharma. So I'm going to ask both of you. I'll start with Caren. I guess first off, you've got a lot of employees that you're thinking about on a daily basis, and that's your team. And then, of course, you have your company helping the practices. This is what I love about our space. We're thinking about helping our practices. So I'll go to you first, Caren, then Jeannette. Caren, what are you doing to help those tremendous people that have got you to where you are today? And then what are you doing to help the practices?
Great, really good question, and very much enjoyed listening to the practices talk about, up close and personal what they've been through. We've spent a lot of time over the last couple of months, obviously, engaging with our employees and with our surgeon partners. From an employee perspective, our goal from the beginning was to try to understand on a global basis, because we operate in over 75 countries, where each country at the local level, at the national level, where they were in terms of managing COVID. And we got an early start because of China. We have a number of employees in China. It is the biggest market in the world, and for us, it's our biggest customer base. And so we realized quite early that this was serious, in that our Chinese employees were basically quarantined from the end of January. And our surgeon partners in China really closed down. And even those who were in a hospital, even if it was an ophthalmic hospital, only the emergency rooms were allowed to remain open for care. And so from that experience and watching over the weeks and months thereafter, by the time it got to early March and then into the middle of March, we realized that we were going to be in a similar situation with our employees here in the United States, where our production and operations facilities are. And so we started to take a really hard look at what we could do and should do, even though we were considered an essential business in California as a medical device company. And what we realized around the 15th of March as the management team is that we had a lot of very frightened employees, and that our production work had been so phenomenal in preparing to send inventory to certain locations around the world to be sure it wouldn't run out if in fact borders were closed. We were able to make the decision that our production employees and all employees should really shelter at home around the world. And so we were able, through what we felt were very strong operating incentives, as well as some excellent cash position over the last couple of years, we were able, with our highly skilled workforce, to keep everybody on payroll with full benefits this entire time.
Right.
We didn't want anybody to worry. We felt that the mental health challenges, the financial challenges were so extraordinary that if we could, we should, and we did. And so our employees have been consistently pleased with our decision. We have made sure that while we were not operating in our manufacturing facilities, that we were putting together really essential COVID-19 requirements with regard to our workplace. So by the time our employees came back on April 27th to resume production, we had everything ready to go. We've hired nurses at each of our facilities who greet you at the door. We bring our questionnaires and we explain, obviously the critical questions about our current health, whether we've traveled, we have our temperature taken. And from the minute you walk through the door, the nurses wearing plexiglass. All of our workstations have plexiglass between them. And we can all go on about all of the safety measures that we've taken using CDC, World Health, local public health consulting, and individuals such as those on the phone and on so many webinars and calls, help from medical device manufacturers and others to do the right thing. So from an employee standpoint, we're feeling very good. We are now putting into place, in coordination with our strategic surgeon partners, what is the new world in terms of entering facilities? What requirements do you all have? How can we honor them? And at the same time, make sure that we follow our own internal guidelines. And so from this, we've had really exceptional discussions with our surgeon partners. We are very carefully monitoring what's going on in the field. We want to be sure that we can help with surgical training, both remotely and on site. practice development, and we have clinical trials going on. And we're very excited that of our 14 sites, the 12 are up, and by the end of the week, everybody will be reopened. So I think from an employee standpoint, it's all about being in it together, real trust between all of us to do the right thing, to take good care, to be honest and forthright, and to be sure that in the production as well side as well as communication side, our surgeon partners feel that we're going to get them the lenses they need when they need them, that the employees who take care of them are very skilled and understanding with regard to meeting the criteria the practices have, and then at the same time making sure we talk about the future, as you said, Jim. There's a lot of opportunity, I think, for ophthalmology to really communicate very effectively right now. There's a lot of misinformation out there about whether or not we really do have a problem, quote unquote, in ophthalmology around touching our eyes, the ocular surface of the eyes, contact lens wear, the fogginess of glasses, and so on. So with all of that, I think we feel very honored to be at the forefront of all of this with all of you.
Well, thank you, Caren. Thanks, STAAR, for doing what you're doing. Now, Jeannette, obviously, Alcon, another large entity, very successful. You've come really into this industry from another great company, I think Boston Scientific in the past, right? Another excellent.
I have, yeah.
So how have you and your team been handling the employees as well as the customers?
Yeah, we took a similar approach to Caren. Number one, I think the common theme or thread between everybody sitting on this webcast as faculty, we all wear a different badge, but we're all employers. And so those that recognize the most tremendous asset to a company is their employees are the ones that have the formulas right. We've been very loud and outspoken about an employee first mindset. You folks are probably recognized as large as Alcon is. We employ over 20,000 employees around the world. We're in over 100 countries. And when you really look at our footprint, talk about complexity, Jim, you know, you're familiar with this with Zeiss. We have to think about different regulations. But first and foremost, we care about the health and safety of our employees. Everybody has a job at Alcon, and our job is to protect our employees. So that was our first focus. The Alcon crisis management team stood up pretty rapidly. A little bit different than you, Caren, as we think about the China. We saw the China business, we saw what was happening, but that didn't drop the supply or demand on us at Alcon, the rest of the world. You think about the date and timing in January, February, China was facing that. Businesses have a certain proportion of their business in China, but the rest of the world was still standing up. So our first focus was, how do we bring safety around our employees? How do we employ protocols that we're looking at hot radar maps and where is COVID, and how do we de-risk the potential of one of our employees getting that? And so we put that in pretty rapidly across the world. And where we needed to abide by state regulations or country regulations, we did that. But the most important thing is, and if you survey an Alcon employee, there's more gratitude than you can ever imagine because we put them first. We hear the media outlets and we think about, you know, not only just the virus, but the mental health issues we're facing with some of the isolation, etc. We stood up resources around our employees to make sure that they felt secure in whatever manner we could. We did not furlough employees, we kept them, and we did that because of the financial status we were in. So as we think about what we did, we still have folks that are frontline. There's, as Amanda as well as Hayley and John mentioned, our reps are still out there if it's a critical case. We ensured something we took as a luxury, PPE equipment in the past. We made sure Alcon wasn't trying to go into an institution and feel like they had to find resources. We supplied them to our employees should you be in the critical need. We also thought differently. This is a time of the new norm. I don't call it the old norm. You hear people going, I want to go back to the old norm. There's maybe things we miss, but we have to be real about how long. John, you commented about how long is this really going to take? The new norm is, what remotely can we do? Can we provide a service that allows you to be clinically supported, but we have to think differently. We also realize how grateful we are at Alcon. The employees feel that, we feel that. So what do? You give back. We encourage. We did a lot of virtual help. We've done funding and donations. We've reached out. I always joke because I'm a technical background. When you put an engineer and a scientist or a chemist in a room, What do you produce? New products, Jim, we've never thought about producing. So face shields, we're putting those out as a benefit and relief effort. We've made hand sanitizers at our plants to make sure the plants or people around us have that new luxury, we'll call it. So there's some of the things we stood up internally for our employees. We continue to do that because, again, we need them to focus. Now, when you make security blanket over top of them and they realize that there are employers behind them in whatever capacity, I applaud the folks that are physicians employing people and what you've done to secure their jobs longer term. They now can focus on how do we think differently. Do we go digital in certain capacities? We have a team of engineers working on, do we need more protection in front of the physician or the patient to try to not allow that transmission either way of a virus? So now let's talk about the physicians. I think our employees are loud and proud. They're smiling. They feel the love and family nature of Alcon, the legacy we stand on. But for the physicians that are out there, never in our wildest dreams did we realize how much digital capability we needed. I think everybody on the line, including myself and the panel, we're high energy, high performing people. We don't like to have downtime. So during the 60 to 90 days, our Alcon Experience Center, not branded, this is where we could take parts of the world that may need an upskill in some sort of skill or capabilities. We saw an all-time high of virtual learning in the time frame that people went with no elective surgeries. We also have to think differently. We all in industry, Jim, you were a leader, Caren, you're a leader. We counted heavily on live meetings to be able to bring new scientific exchanges. And so as we're standing up new technologies, I know multiple companies are thinking about operational efficiency. We need to speed that up because we need interfaces that, as we think about capacity, I hear Amanda, I hear Hayley. Hayley, congrats, June 1st if you get to 100%. There's going to be a reality that the whole world's going to have different volume and velocity. We have to think about that operational efficiency. So we're working on that. We also, from a support service, where things people don't see industry, and I'll say we, not just Alcon, but Alcon took a very large presence. When you think about the Hill and the stimulus package that was being debated, it doesn't matter what political stance you're on. We at Alcon took our government affairs and said, are they thinking about the ophthalmologists? These are some private practices. What does that stimulus package look like? And are we thinking about all areas? You know, we've got a diverse population. It's not just cardiology, which is a large presence. Ophthalmology needs to have some of that stimulus package as well. The other thing that was front and center for us was telemedicine. Does everybody, Hayley, you seem very, Amanda, I know your practice, John, you guys are at the front. But what about that middle person that isn't business savvy, doesn't really understand how to bill and code for telepresence? How do we in industry, knowing we have the best practices, we stood up websites to ensure every practice has an opportunity to generate revenue in a really tough time. So we're really thinking about our capability to bring best practices. And then our last hurrah is we think about when we stand up, we say turning the lights back on. Our theme right now is steady as we go. None of us have chartered this path before. So collectively, Jim started out that way. We have to navigate it together. This isn't about promotion. This is about the industry helping each other to survive and get through this, which we will. The last piece as we stand up is, you know, we've been reaching out to our international colleagues. You know, what are the protocols? What's the best practice that we can enter patients from a communication? So as we think about the virtual ASCRS coming this weekend, we've partnered on ways to turn on the lights, we call it. Putting things in place that your average business partner, and maybe they're not a business partner, they're a physician that is running a business. How do we ensure their success in the future? So, Jim, we're committed to both. Our employees feel it. They feel the surrounding and the support from Alcon. But now we need to make sure we're supporting the surgeons as you stand back up. So you have Alcon's full commitment. We're thinking differently. We're bringing out PPE equipment in collaboration with our consumables. And we're ready with inventory when you're ready. So thank you, Jim. I'll turn it back to you.
Well, thanks, Jeannette. Thank you very much. Great perspective from both Caren and Jeannette, the industry, which again makes me always thrilled about what's happening. So I kind of, after Amanda, Hayley, and John talked about, I talked about that every crisis, whatever crisis we've had in our tenure in both business and personal, there's always a learning, and it's a good learning. So I guess I'll go right to you, Amanda. What one or two things have you seen that's been unique and actually has created some new ideas out of this crisis that you think will continue as we move forward? What do you think, Amanda?
So I think, for the last couple of weeks, we've had conference calls, webinars literally every day with some of the leaders in Europe and some of the leaders in the US. And we've tried to take like the best ideas from everyone and create something that exemplifies Carones vision and takes all of those into account. So, the things that we've done, we've implemented patient webinars, so broad webinars where we've had, a couple of hundred people at a time join, that were, of course, one directional with type-in questions. We have done small group webinars in an aperitivo type setting where it was open dialogue amongst the entire group and not a specific set agenda. We would speak for about 5 minutes and then open it up to whatever questions people had. And then we've also implemented one-to-one, no-cost meet and greet conversations with the physicians. So since our schedule had already been designed in a way that the physicians had a break in between patients, because it's not about the doctor, it's about the patient and providing the best possible patient experience. So in many cases, the doctors automatically have a built-in 10-minute wait in between visits. So we decided to fill those 10-minute waits with one-on-one meetings that patients could call and schedule. It enabled us to build confidence with patients, whether they were an established patient or a new patient, in that we've done everything that we can to provide the safest environment for them. It gave them an opportunity to interview the doctor to make sure that this is a doctor they felt comfortable providing care. And it gave the doctors an opportunity. In most of these cases, they were patients who were interested in some sort of refractive surgery, be it laser refractive or cataract refractive. So it gave the physicians an opportunity to start interviewing the patient to understand lifestyle vision needs, so that when the patient came in for their visit, the family member could attend the webinar, the meet and greet in advance. When the patient came for the visit, the family member didn't need to arrive with the patient. The physician didn't need to interview the patient in the office. They were able to go ahead, rely on that telephone interview or webinar interview to make a suggestion for what lens or what procedure might be best. And then the other thing that we've introduced that has had tremendous success is a home visit service. So we have a young ophthalmologist who's joined our practice. We have a number of handheld devices, for example, handheld slit lamp, obviously tonometers. We can do anterior and posterior segment exams. So we are now, if you live in the city of Milan, we can load him up on his scooter. He can go to their homes and perform these visits there, primarily for patients who may be immunosuppressed or are elderly and are afraid to leave their house for risk of exposure. So that's also garnered a huge response from patients.
Great. Hayley, what have you learned? What's been the one or two things that's kind of created out of this crisis?
There are several actually. I'll only hit on the top ones, but I think the adoption of technology, not only for our team, but also for the community of people that we serve, was kind of, it was thrust upon us. We had to figure out the whole technology thing. And rather than worrying whether or not patients would adopt the technology, we took the approach that this is going to be part of that new norm, as Jeannette was kind of talking about. And so we called up our EHR company. So we had gone live with a telehealth solution, and it was great, but it was not native to our EHR system. And so we wanted to see if there was something that was going to be more seamless for us. Our EHR company had just kind of launched their first iteration of it. We went ahead and volunteered to be a beta site and decided that we were going to be providing feedback throughout the entire process. And so we were able to do that, which gave us a really interesting perspective on what's to come for telehealth for us, at least in our community and our practice. But it gave us the opportunity to really focus on virtual visits. And once we kind of mastered the whole virtual visit thing, we said, okay, well, what other ways can we do this? It's not just about routine exams. So we implemented a drive-through testing center, and that is live at our clinic locations as necessary. And those are those handheld devices that Amanda was talking about. And so we have the opportunity to do IOP checks and to get a, a picture of the back of the eye. And we can get some different things just by handheld devices. And we can check vision and pupils and EOMs and different things without ever having somebody get out of the car and touch a bunch of things in the office, right? So we're able to reduce foot traffic just by, implementing those types of drive-through testing sites. We also looked at our mobile unit. So we have a mobile examination unit that we've used for charity purposes over the last 2 years. And we said, hey, there's not going to be a lot of opportunity to go to schools and to senior centers and all these different types of things that we're, traditionally doing. So let's go ahead and use that as a frontline unit. And so we're able to take all of our red eyes, rather than bringing them into the office and potentially contaminating the office, we are now able to take all of our red eyes onto our mobile unit so that we can still give them this incredible care and give them this personalized attention in a super safe setting that is easy to be wiped down because it's used to having, kindergartners, for example. So it's very used to being able to be wiped down and disinfected frequently. So that's another thing. The most important thing, though, I think, is the virtual try-on for optical and the virtual consultation for refractive procedures. And so we've actually had an uptick in refractive consultations, all done remotely. We've done some Facebook Lives where we actually give tours of our offices and our surgery suites. We actually show them what it looks like underneath the laser. So we have had some fun showing people what it looks like from the patient perspective before they ever even have to come into the office. So there's been a lot of engagement with that we've done, even just through social media, that I think has gained some traction that will allow us to continue to have strong numbers throughout the remainder of 2020, even though this past 6 weeks has been incredibly devastating to everybody. But thankfully, some of these opportunities we've jumped on early, and we've kind of taken that position in the market that, hey, there's still opportunity. And when people are at home, it's a captive audience. So let's go ahead and continue that conversation and dialogue with them. And that's what we've done.
Thanks, Hayley. John, what's been the one or two things you've noticed?
Well, we've heard a lot about technology, but I think that is absolutely, it's been a catalyst for change. I think the genie's out of the bottle for telemedicine. I think that will be part of what we do in the future, no matter what. And it's proven that our patients will accept the technology, and it's proven that we can actually have a personalized visit in spite of the fact that there is distance. And we found that the same thing as you, Amanda, we're having these one-on-one calls with myself and a patient or the other doctors in our practice, and the patients really enjoy the one-on-one attention that, quite frankly, feels more focused than they might have had in the office sitting in the chair. And it also provides this personal sense of, all right, we kind of see what the background is, and it's really okay if a dog runs across. I mean, we're all human, and we kind of get that part of it. I think that has helped us understand that we are all in this together, but it's helped us understand that this is a tool that we will continue to use. I think it's also been a change that we can anticipate from some of the regulations that, maybe have been born from fear of competition, maybe from just because it's the way it's always been, but there's been relaxation of who has been allowed to do what things. And quite frankly, we've found that has been a positive, that it's helped us been able to expand our care. It's helped us been able to take care of our patients, and I think we're going to see that is important and increasingly a part of what we do. So the silver lining to all of this, it's informed us, and we've had no choice but to rethink how we deliver care, and I think it will address the increasing need that demographics suggest we will have, that there are fewer eye doctors that are being produced with greater demand, and these are the sort of things that were going to happen anyway, but now there's been a catalyst to that. And so I see this as a positive. I try to take a positive attitude towards these things, understanding that the adoption and the adaptation is going to be a little painful, as it always is, but I think that we will change for the better.
Before I let Gaynor take some questions from the audience, I would summarize perfectly what you said. I think this was going to happen. I was talking about a phenomenon in previous seminars. Too many patients, not enough physicians. Mm-hmm. Talk of healthcare, I called it the red, yellow, green, where you can't see everybody sitting in a waiting room, and people shouldn't have to wait 3 months to see the great Dr. John Vukich, and they shouldn't only get 5 minutes of your time, and they shouldn't see the back of your head while you're putting the stuff in the EMR. So I do believe that this remote care, and I know at Zeiss are spending a lot of time and energy, this is going to be a critical element that we had to do. And it's kind of like what happened after 9/11. It changed how we flew, and it actually made it a more fluid process. So out of this crisis sometimes creates necessity, and I think we'll all take advantage, but I'm where Hayley is with the fingers crossed. Let's get it going quicker.
Yeah.
So with that, we've got about 15 more minutes, and I know we have a lot of questions from the audience because I got to shut up and let the audience ask you the right questions. So I'm going to let Gaynor, why don't you shoot some great questions we have from the audience to this great panel?
I would love to. Thank you, Jim. So one question, how are you seeing clinical trials impacted? What do you think will be the pace that these trials come back to? That's a great question from Jeannie.
So, well, Caren, I think you were talking about it, and Jeannette, why don't you address it? I think you both were kind of talked about that. Caren, you want to hit it, and then Jeannette, you want to jump into it?
Sure.
Sure.
So, our experience is, first of all, that along with our CRO, we stayed in constant contact with our clinical trial sites to be sure that we remained in protocol, dependent upon where the patient was in the cycle, so that we could either have a remote or in-person follow-up as required. We also, during that time, made sure that, we provided for, through the CRO to our surgeon partners, whatever they needed in terms of communication, to either get ready post, meaning when we start up again, in terms of communication. So a lot of advertising on the clinical sites is already up and running. There were a lot of patients in the queue, but I think the biggest takeaway for me and the enthusiasm is how much the surgeons were excited to have patients waiting, who were part of the clinical trial, who they could immediately bring in. And obviously, it's good to get that revenue flow starting right away, and bringing back all the individuals involved that are required, of course, for a clinical trial. So I would say from our vantage point, we feel it has been, in a way, even more exciting in terms of what our options and opportunities are in working with our partners during this time in clinical trials.
Jeannette?
And the only thing I'd add to that, of course, you're going to see a delay. People are not doing procedures. So if you had a clinical program in flight, of course, we're going to see a little bit of delay. What it makes us think about, and most of the protocols are written to allow either remote follow-up and or in person, depending on the analytics or data point you're trying to capture. In certain instances, we did see an increase on things we were asking on ergonomic data, et cetera. We also saw, to our surprise, as the demand's going to come back in June, several IITs where physicians realizing you're going to have a large load coming back to you as far as patient volume. Can you study something? So we had several IITs, investigator-initiated trials, submitted to Alcon because of that pent-up demand. So I think what it's going to force us, Jim, really, if the person's asking a question, we're going to have to think differently. There is going to be a negotiation. I used to run regulatory clinical around what are the critical data sets we need. Is it all going to be true clinical follow-up? How do we get some of these measurements? I think it's going to evolve with data capability and digital capability, Jim, as we move forward. We'll see a flight delay. We'll continue those, but it's going to force us to really think differently.
Before Gaynor, John, you want to add to that, John, because I know you do a lot in your practices.
Well, I just wanted to add that there's always something new. And so for what we have today, there's always a plan for what will we have tomorrow. And I've been lucky enough to be involved with some of the early clinical research that is done for what we are going to see in the future. And I can tell you, we are on the verge of a renaissance right now. I have never seen so many amazing products, both in technology, in implants, in lasers, as well as pharma. And they are all on the cusp. So it is something where we have an exciting future in front of us, things that we will start to hear about over the next 6 months, maybe a year, but we're on the dawn of another breakthrough. So research has not stopped, I assure you, and the technology that we will have at our disposal in the very near future is remarkable.
Gaynor, you got another question from the audience?
We do, yeah. So kind of two prongs. So from the corporate side of things, how are you guys addressing the reps entering the offices, PPE, doing it remotely, those kind of things? And from the doctor's side, do you see the way that you work with reps from industry changing? So
Jeannette, why don't you hit the one from industry, and Caren.
Okay, so from industry, it's interesting. We, number one, rep access across the country. I'll talk domestically in the U.S. We just had a call with AdvaMed on Monday. Look, it's variation across the country. Where we can provide remote access, we do. We have to think both directions, though, depending on the specialty. If the rep's needed in on the surgical procedure, we're getting together with AdvaMed as an industry. There's lots of partners on that call. Everybody we can think of, every company, on how do we face this together and set a protocol, whether we use vendor mate, rep mate, whatever, to show whatever credentials we need, antibody testing, et cetera. Can we create some sort of baseline consistency for our sales force, that we're not all trying to do this solo, because it'll create chaos. And you're not going to know from one company to the next what the standard is. So we're first and foremost trying to set standards as we stand back up. We're really evaluating, and we're doing some market research around when do you really need a rep and when do you not need a rep. And we've also instituted remote access. If you really need a rep remotely, we've had docs call us. We are in that OR remotely with them to make sure we're navigating a positive clinical outcome where appropriate. So we're doing all three. Let's set standards. Let's think about remote capability, and let's have the rep in there, and we do supply our PPE. There was talk, though, on the AdvaMed that some hospitals are requiring their own PPE just to make sure it's standard. Let's see if that's going to be a standard across the United States. There's limited supply. So as a company, we are supplying.
Thanks, Jeannette. Caren?
From our standpoint, we really are doing it on a case-by-case basis, in that we have strategic partnerships, of course, around the world. And we do have with them a lot of what I would say joint decision making as a part of our partnership. And so that's really where we've begun this process, from China into Europe and now into the US. And then what we learn there in terms of what individual preferences are, we try to make sure we can accommodate. So on one side, we're preparing all of our field-based people, regardless of responsibility, with the tools to be ready and able to make those calls. We also have really pretty much got a master's in digital communications at the same time. And then, but what's most important is for us to have the flexibility to be able to work with each customer who has a unique set of standards that they want us to follow. And so, the way we see it is, if you're a big hospital, there's going to be one set of standards. If you're a small practice, there's going to be another. And we want to make absolutely sure that we are able to adjust for each of them with the toolkit that we have internally. And so we're rolling all of that out in each of the markets around the world so that they meet the regional requirements, the partnership requirements, and also the new customer requirements, of which there are many now who are getting much, much more interested in refractive surgery as they see the younger patient population being a bigger part of the future than they ever imagined, especially over the next 18 months, where some of the vulnerable population, as we described them, may be more fearful to have procedures done.
So Amanda, Hayley, and John, just quickly, from the medical profession, do you want to see reps come into your practice? Now, I mean?
We've always had a great relationship with industry. I think that's what makes our profession special. And yes, I enjoy the personal relationship that I have with the reps who come in. And quite frankly, they have great interactions with the faculty, with our staff, and with our faculty. They bring in things that we need if we're out in the moment and we have an emergency. I think it's a great relationship, and I hope that doesn't change.
Yep, and I would agree with that. I want to echo exactly what John was saying. We absolutely love our reps. In fact, one of the questions that I was going to answer was actually giving Alcon a shout out, because after the last OWL webinar, I had 3 or 4 of my different Alcon reps reaching out, and so as a result, we ended up doing several phone calls, exchanging of text messages, and Zoom meetings, and a variety of things. And so those types of relationships have have not only continued throughout this, but I think in some ways, at least with some of my partners, is like what I like to call them, if they strengthened. And so we've actually moved beyond a transactional relationship, and we're moving into more of a partnership and even a friendship. And so I really hope that that continues. We have not, we haven't had a single rep come in over the last 6 or 7 weeks at this point. At this point, everything has been done remotely. But, if people go through, at this point, we have a checkpoint before anybody enters any of our buildings that you have to go through a health screening. And so that goes to even down to the mailman and to, the FedEx driver. They all have to go, if they want to walk into our facility, they have to go through a health screening. And so and the health screening is basically some basic questions and temperatures and different things like that. But if we had a rep that needed to come in, they would be able to go through that entire process and still be able to come in if we had some type of urgent need that would require that. But absolutely, I like the approach that Caren, you're taking as a case-by-case basis, because you're right. At a hospital facility or a giant, health system, very different needs than us as a 2 OR ambulatory surgery center. So I look forward to welcoming reps back in with open arms when it's safe to do so.
Amanda, what do you think?
So our practice is probably a little different from the others. We actually don't have a lot of reps who come in the office at all. Most of our relationships are with the regional teams, some of the marketing teams here in Italy, but most of them are regional and global. So it's very, very rare, only a couple of times a month, that we might actually see someone from industry in our practice, with the exception of field service engineers. Now, for the FSEs to come in, I would imagine that they'll go through the same screening that anyone else who comes into the office goes through, whether they're an employee or a patient. So they'll have the infrared cameras. We offer antibody testing at the clinic. So all surgical patients automatically get antibody testing. Clinic patients have the option, if they want to do it, they can. We don't charge surgical patients. We do charge the clinic patients the cost that we pay for the test. I would imagine that we would require them to do it there in the office. We wouldn't accept the certification that they would bring with them, because that can change from one day to the next. So I think the FSEs would probably still be allowed in. I don't see us allowing reps in the OR at all, unless it's a new install for quite some time. Over here in Europe, we're actually hearing, for example, in France, I heard today that they're considering not allowing any reps inside the hospitals for the next year. So some industry is already looking at laying people off there, and I think we would probably see something happen similarly here in Italy, especially with us being hit so hard. It won't affect the private practices as much as it would the public hospitals, but of course the bulk of the business is in public over here.
So Gaynor, I think we're coming to the end here. So if I can summarize, first off, I want to thank the panelists. Everyone has taken their time, and Amanda, you get an extra gold star for doing it this late in the evening. But all of you have done a tremendous job. All of you have become experts at this. So the one thing you should learn is that you can now go on TV, because you all project very well. So there's a movie and a TV future for each and every one of you. I want to thank OWL. They have been the continuous support network here for a lot of us in industry and in practitioners. And then I always leave with the final. This is my 40th year, and I still get a chill, because everyone on this panel and people that are listening do something remarkable. You help people see. And so throughout all this COVID, you still should be proud of what you do, because somebody is seeing better. Somebody's uncle, somebody's aunt, somebody's grandmother is seeing better because of what you all do. And if that doesn't get you excited, nothing will. So on behalf of OWL, on behalf of myself, who is the veteran of all of you, thank you for what you do, because you're making a difference. And even during this difficult times, with the smiles I see all of you, I would love to be one of your patients or on one of your teams. So thank you on behalf of OWL. Gaynor, thank you. Beth,
thank you, Jim.
Congratulations, continued success. I wish all of you and your families nothing but safety, and your family and your friends continued success. And let's get this thing over with so we can get back on an airplane and have some fun. All right? And thank you all. Thank
I'll
you very
second
much.
that.
Best to
Thank
all of
you.
you.
Everyone.
Thanks, Jim.
So
Thanks,
wake up.
panelists. Thanks for
Amanda,
joining us.
Princess gonna wake up. See you all.
Thanks, everyone. Fantastic panel.
Hopefully you let me sleep in.
Yes, go to bed, Amanda.
Go to bed, Amanda. Good night, everyone. Take care.
Bye,
Good night,
group.
guys.
Bye.
Good night, everybody.
Thank
Stay
you.
well.
Bye.